Welcome back, welcome back. By now you've heard of all the GLP-1 analogs out there like the Saxenda, Ozempic, Wegovy. These are the injectables FDA approved for weight loss and or diabetes. We've heard the success stories, how people's lives have been changed. In my last video, I did one with all the pros and cons to the specific medications where I listed how they're administered and some of the serious side effects and again pros and cons. Please watch that video for more detail about each medication. So since I did that video, there have been more reports coming out about really serious side effects that I really wanted to discuss because these are side effects that have not really been talked about as much in the media or hardly at all. So if you have a loved one that is taking one of these medications, Mounjaro, Wegovy, Ozempic, all of those medications, then please sit back and listen. Listen. Okay, so for those of you who don't know me or are new to the channel, yes, I post a lot of lifestyle videos, a lot of cooking videos, a lot of shopping hauls, but I also happen to be an internist, internal medicine doctor, US trained in the United States, okay? I have an extensive medical background, and as much as I don't use it often on this channel by choice, today is one of those videos that is very serious and I'd really like you to pay attention because you might learn something new. So over the last few months, or maybe even longer, a lot of doctors around the country have been finding a lot of serious side effects related to these weight loss medications. And I'm talking about ER physicians in particular and also surgeons around the country. So to illustrate this point before I go into what they found, let's talk about Lisa Marie Presley. Lisa Marie Presley, the daughter to the global superstar Elvis Presley. I mean, who didn't know Lisa Marie Presley, or who has never heard about Elvis Presley, right? I'm sure you know who I'm talking about.
Elvis Presley was called the king of rock and roll back in the day, and he was the most famous singer and actor back in the day. He married Priscilla Presley. She was beautiful. They had one child together, Lisa Marie Presley. That was his only daughter. But unfortunately, he died tragically in 1977. I grew up watching him on television. He was really more of my mother's generation and my grandmother's generation, but I will say he is still loved by so many people, even now that he's gone, and his music is iconic. So Lisa Marie Presley, the only daughter of Elvis Presley, here in the leopard print blouse, she grew up to be a singer, a songwriter, a humanitarian, and also keeper of her father's legacy. Apparently, she was married several times, including at one point to Michael Jackson and also to Nicolas Cage. Yes, she was a celebrity, but she was also a loving mother to 4 children, including twin girls. In 2020, tragically, her only son died at the age of 24, and as expected, she was devastated and blamed herself. Over the years, Lisa Marie Presley continued to promote her father's legacy, and we would often see her on magazine covers with her mother, Priscilla Presley, and daughter, Riley. Lisa Marie Presley always appeared to have this sort of quiet strength about her, in my opinion, and she was always such a fashionista. She always looked well, dressed well. At the Golden Globes earlier this year, when Lisa Marie Presley came out looking like this, honestly, we were all shocked. What happened to this vibrant woman? Why was she looking so frail and so sickly? I knew the look. I immediately recognized that she looked like she was under the influence, but why? And then it came out that she had died. It was shocking. Honestly, it was shocking, and I wanted answers. I wanted to know why.
So in January 2023, reports came out that she died of natural causes related to weight loss surgery, and in particular SBO, or a small bowel obstruction. And I remember reading those thinking, it just doesn't quite add up to me. How a younger woman, because she wasn't that old, she literally was only a few years older than myself, and in her 50s. How could she have died of, quote, natural causes? And there had to be more to this story, right? Some people speculated that it was most likely due to drugs, or most likely due to a relapse in her addiction, because she did have a drug history in the past. But again, these were just speculations. So I waited to see what else, you know, the autopsy report, or what else the experts would say. So it turns out, according to the autopsy report, that she did in fact have narcotics in her system, or controlled substances, as in oxycodone, which is a controlled substance, but apparently it was at a therapeutic level, meaning that it was not at a very high level, but at a level you would expect for someone who was taking it because it was likely prescribed. So she had oxycodone in her system along with some other substances, but again at therapeutic levels, which means that it wasn't at a high enough dose to cause her death, or it did not appear to be the significant reason that resulted in her death. Now, as someone who was not directly involved in her care, the question that came up in my mind was, why was she being prescribed narcotic? And who would prescribe this medication to a recovering drug addict, right? You know, what was going on that led her to be taking these narcotics? As I stated in the beginning, one of the things the autopsy found was a small bowel obstruction. And a small bowel obstruction is basically blockage of the intestines, which can form as a result of adhesions. Now, adhesions are basically growths that happen after you've had some kind of bowel surgery. Now, in the case of Lisa Marie Presley, they stated that she had a strangulated small bowel, which is something that can result if the small bowel obstruction isn't treated. She had a strangulated small bowel caused by adhesions that developed after bariatric surgery years ago. And this is a long-term complication of any abdominal surgery, and in particular bariatric surgery. So it is definitely a risk factor, but it is a very rare cause of death. So here's some serious questions that were raised when most of us found out, especially health professionals, found out that, you know, this was due to a complication of bariatric surgery. The obvious questions were, why did she need bariatric surgery? Typically, most people who have bariatric surgery have serious comorbidities, including a BMI of above 35 typically, or even more. Was Marie Presley ever that big, or was she ever, you know, technically morbidly obese? What other comorbidities did she have to warrant that? Most people who have bariatric surgery have to go through an extensive amount of testing and even psychiatric evaluation to make sure that they are ideal candidates mentally, but also are willing to go through the changes required once you go through that kind of surgery. So you do wonder who performed that surgery on her. And again, why did she actually need that surgery? Now, of course, she is part of Hollywood, or was part of Hollywood, and there's a lot of societal pressure to look a certain way, especially as you're getting older, or especially as a female in Hollywood, if you actually have a weight problem. And I believe they interviewed quite a few of her friends who said that they had no idea that she had bariatric surgery, or that she even ever needed it. And so, you know, there is that question, was she an appropriate candidate for bariatric surgery to begin with? Now, according to the people that actually knew her really well, interestingly, they said that for months she was complaining of abdominal pain, and that she had nausea and vomiting and even fever for months and did not seek help. Now, obviously, I did not know her personally. I don't know how accurate those reports are. There probably is some truth to that, but it's really disturbing to know that this woman was suffering for months before she passed, again, complaining of nausea and vomiting. And obviously she had significant weight loss as a result of her symptoms and as a result of the problems that were going on in her body that went undetected. So according to her mother and according to the reports, on January 12th, Lisa Marie Presley was found unresponsive at her home, and she was rushed to the hospital. They tried to do CPR on her, but despite all of their efforts, she went into cardiac arrest, and unfortunately, she passed away. She died. So why would I tell you all of this? What has this got to do with these weight loss medications? Why am I bringing this up? Why is it relevant to you or to anyone that's taking Wegovy, Ozempic? The reason why Lisa Marie's story is relevant to all those people taking these different weight loss medications is because around the country, more and more surgeons and ER physicians are seeing a lot of abdominal issues, a lot of GI complications. They're seeing small bowel obstructions in a lot higher numbers. They're seeing a lot more people with nausea and vomiting and electrolyte imbalances. They're seeing people who have gastroparesis. Gastroparesis is basically like a paralysis of the stomach. More and more of these cases are coming into the emergency room. More and more cases of pancreatitis are coming into the emergency room. People are landing in the ICU. People are requiring significant amounts of IV fluids, sometimes even surgeries, all because a lot more people are taking these weight loss medications. So that's why I felt like it was necessary to discuss Lisa Marie Presley in this case. Now, many of you may have heard of Dr. Terry Dubrow. He's a very famous surgeon. You've probably seen him on the show Botched. You know, the show where different people come in complaining about botched surgeries that they've had in the past. Anyway, so they have a show called Botched. That's where he's most famous for. But he is a real surgeon and he does see patients. And in a video he did a couple of months ago, he really highlighted some of the problems he's been seeing and noting, especially, in Hollywood, where so many people are taking these weight loss medications. Some of these people are not necessarily obese, but they're taking these weight loss medications. They're not diabetic, but they're taking these weight loss medications. And he's seeing a higher number of people coming in with, GI issues, even ending up in the ICU with all kinds of problems. So in that video, which I will link in the description box, it's a short video and worth listening to, honestly, for anyone that is taking these medications. He highlighted how a series of 3 events or 3 situations together could increase your risk of death. Number 1, you have people that have had gastric bypass or have had some sort of weight loss surgery, and these people are at a higher risk of adhesions, which means they already are at a higher risk of small bowel obstruction or have some sort of disruption to their motility or intestinal tract. And then when you have those same people who may have had gastric bypass or some sort of, again, weight loss surgery that end up taking weight loss medications, one of these GLP-1 agonists, which also slows down your bowel. As we know, these medications slow down the motility or the movement of food through your intestinal tract and keep you feeling full. That's how they, apparently work. Or that's how you end up losing weight, because you also tend to eat less because you feel full often, or you feel full most of the time, right? So you have someone who may have had weight loss surgery now that is also taking weight loss medication. Then you take those people and now perhaps for something totally unrelated, maybe they have arthritis, maybe they have joint pain, maybe they have something else where they are now taking painkillers. And as we know, painkillers, especially, in particular narcotics, slow down your bowels. So people who have if you've ever taken narcotics, then you know what I'm talking about. You are more likely to suffer from constipation. You're more likely to complain of hard stools, or you're more likely to have difficulty going to the bathroom in the same frequency as you used to. So anyway, you've had bowel surgery, you are taking weight loss medication, and now possibly you are taking painkillers. That is a recipe for something horrible and tragic and catastrophic to happen, or even death. So that is what he suspects that may have happened to Lisa Marie Presley. I will say this, we do not know if she was on weight loss medication, but we do know she had GI surgery. We do know that she had narcotics in her system. Both situations slow down your bowel function, and both situations, when added to weight loss medication and narcotics, are again a recipe for disaster. It's quite possible that this went on for so long, the small bowel obstruction that she had as a result of adhesions, because she couldn't feel the pain as severely as someone who was not taking pain medications. So the pain medicines that she had in her system prevented her from feeling how severe the problem was. Or maybe she was trying to, again, self-treat. Maybe she got those prescriptions from a doctor who did not realize that she had a serious problem. I don't know. But again, the facts are she had bariatric surgery. She did have narcotics in her system, even though it was at therapeutic levels. Her small bowel obstruction due to adhesions ended up progressing to strangulation. And would you believe it? They said that 30 feet of her intestines died before she got to the hospital. So I can't imagine the amount of pain she was going through, and I can't imagine how toxic her body had to be. So for those who have never had bariatric surgery or never considered bariatric surgery or weight loss surgery, you're probably thinking, like, why would someone have surgery and then turn around and take weight loss medications? Well, there are a lot of people who've had bariatric surgery where after a couple of years, the weight starts to come back, maybe because they did not adhere to their lifestyle or the proper lifestyle to maintain that weight loss, or for different reasons, they are not able to lose the amount of weight completely that they wanted to. So you're finding that there are more and more people who, despite having weight loss surgery, go and request these weight loss medications. Again, because they're trying to get to a specific weight that they have not reached. And also keep in mind, when you're talking about people in Hollywood, the pressure to look a certain way is so much greater. So I can understand how some women would feel extremely pressured to want to take these weight loss medications. But for people like you and me that are regular, normal people, really want to stress that these medications are not really for wanting to lose a few pounds just to go to your graduation party or just to go to a wedding. I want to lose a few pounds, so therefore I'm going to go see my doctor and get prescribed Ozempic or Wegovy or make up some story, just to get these medications. So again, Dr. Terry Dubrow describes it as the perfect unfortunate storm. Perfect unfortunate storm. You basically have someone who has had previous surgery with intestinal scarring, someone who is also taking opioids or pain medications or narcotics. So you can't tell how sick you are, and therefore you can't feel the pain as much as you should, who has further slowed down their GI tract by taking these GLP-1 analogs, and causing further slowing of their intestinal tract. So again, the perfect storm. As it pertains to Lisa Marie Presley, there was nothing natural about her death. It's quite possible that if she had not had that bariatric surgery, she would have been alive today. And it's also quite possible that if she had sought medical care sooner, she could have been alive. And if she were not on narcotics, blunting the pain that she was feeling or suppressing the pain that she was feeling, that she might have been alive today. So it's really tragic and really sad, because She could be any one of us, really. So what can you, sitting in your living room, considering taking these medications, or maybe you know someone who is taking these medications, what can you learn? We know that there are going to be people who have zero side effects or zero major complications, and you might be one of them. And then you might know someone who has had significant side effects or complications and had to come off the medication. So the point is, some of us will have side effects, some of us will have no side effects, and some of us might have a combination of side effects or complications, whether it be nausea, loss of appetite. There are those that might be suffering from fatigue a lot more than they would like or than they anticipated. Those that have constipation a lot more. And again, then there are those who are really not bothered by these medications. Please comment below if you are one of those people. I think it's also very important, and you may have heard this already from your doctor, or you should have, is that be on the lookout for significant abdominal pain, especially abdominal pain that persists, significant constipation, significant cramping, significant nausea or vomiting that persists. You know your body. Please do not ignore the signs. Please do not drink while taking these medications. But if you happen to be someone who has those symptoms and you're a drinker, alcohol, and you are taking narcotics for some other reason, some other legitimate reason, please see your doctor. Please let them know, again, that you are on these weight loss medications and you have some of these symptoms that I highlighted. Sometimes if you're going to a different system, where one doctor is in one system and another doctor is in another hospital system, sometimes their records do not communicate. Or again, you have patients that don't always come out very forthright, don't always give their entire history, because at this point it is not a secret. Medications like Ozempic can cause small bowel obstruction, can cause pancreatitis, can cause gastroparesis, and all of those things are very serious conditions that can be life-threatening if not caught in time. Again, maybe you have arthritis or joint pain or back pain or some other cause, and you were prescribed a narcotic like Percocet or oxycodone or whatever the narcotic is. Just realize that it can be very dangerous when taken in combination with other drugs or other mood-altering drugs, or taken with weight loss medications like the Ozempic. Another area that I feel has not been covered significantly are mood disorders and how these GLP-1 analogs have affected people with mood disorders. And when I say mood disorders, I mean conditions like anxiety and depression. I don't know if you realize it, but a lot more people taking these medications have been complaining of increased levels of anxiety. Now, again, I am not saying everyone who takes this medication is going to feel this way, but there are significant numbers of people who are complaining of more anxiety while taking these medications, and also higher levels of suicidal ideation. This is real. This is not something imagined. More and more people are feeling this way. It is a real problem and a real potential side effect that you should look out for. Personally, if I had a mood disorder, I think I would really think twice about taking some of these medications, because it can exacerbate it. Remember, these GLP-1 analogs don't just act on the GI tract. They don't just act on the intestines and the pancreas. They also help activate certain cells in your brain, specifically in your hypothalamus. And everything that I've said today, you can fact check, you can go and look it up for yourselves, do your research, okay? When you think of these medications, the reason why they may exacerbate your anxiety or your depression is because, again, it's not just acting on the GI tract or the pancreas, but it's also acting on certain areas of your brain. So if you have the time, go ahead and look up orexin, okay? Look up orexin and how it pertains to the hypothalamus. Now remember, the hypothalamus controls things like satiety, feeling full, It also controls things like your sleep cycle, important bodily functions like that. So apparently research shows that people with anxiety have more orexin A than people without anxiety. And per a neuroscientist, GLP-1 agonists excite orexin neurons to produce more orexin and cause more anxiety and depression. So the side effect of increased anxiety can happen at any dose of Ozempic. There isn't a particular dose that you may start to feel this way. It is quite possible that in majority of the cases, it happens at the higher doses, but for some people, it may happen at even the lowest dose of Ozempic, or again, these other medications, Mounjaro, Wegovy, you know the list. So in short, despite the significant benefits of these weight loss medications and some of these medications that are used for diabetes, I would say it's really important to pay attention to what's going on in the news, pay attention to the research out there, and please see your doctor, talk to your providers, ask questions. Unfortunately, society, especially in the Western world, gets so excited, gets so hyped up about some of these new drugs. The pharmaceutical companies stand to make a lot of money, or have made a lot of money with these medications without really enough, in my opinion, enough regard for the long-term consequences of these medications. I don't think that there has been enough research, long-term research about these medications, because more and more side effects are being discovered. And some of you may disagree with me. Full transparency, I don't feel comfortable taking it, but I know that there are a lot of people taking these medications. I think as long as you understand the risks and the benefits, and you feel that the benefits outweigh the risk in your particular case, because everyone is different, then yes, you should go ahead and take these medications, because you may have already tried diet and exercise and maybe it doesn't work sufficiently for you, or you're not a good enough candidate for diet and exercise alone. It's between you and your provider. I'm not here to judge you for taking the medication, and if it works, wonderful. Now, the lawsuits have already started. Lawsuits have already started, and I'm going to read a few that are of interest to me. So one major lawsuit filed against the makers of Ozempic and Mounjaro, which was also highlighted on Good Morning America, and if I can find that, I might link it. But anyway, the lawsuit alleges that the pharmaceutical companies Novo Nordisk and Eli Lilly should have included more explicit warnings about the risk of using the drugs. For example, gastroparesis, which is stomach paralysis, severe dehydration, electrolyte imbalances, etc. Keep in mind, though, however, that the label does include, it does say that nausea or vomiting is a risk, or delayed gastric emptying from mild to moderate, and typically would occur in a short duration. So again, this is per the pharmaceutical company. So another major lawsuit is from Wegovy and Ozempic, the makers of Wegovy and Ozempic. They're actually suing makers of compounded drugs, okay? So yeah, Ozempic and Wegovy makers sue compounded off-brand versions of the popular drugs used for weight loss. So the legal action is against medical spas, weight loss clinics, wellness clinics of non-FDA approved counterfeit and compounded semiglutide products, claiming to contain semiglutide. So basically, you know, the makers of Wegovy and Ozempic are suing these other companies that are out there making these compounded medications that are non-FDA approved. So I know that there are people who cannot afford to get the real medications, and so they're getting some of these off-brand compounded drugs for weight loss. And there's always a risk, because some of them don't actually contain the real drug, semiglutide. So, including allegations of false advertising, trademark infringement, and unlawful sales of non-FDA approved compounded products. Thank you so much for listening, and I hope you found this video informative. If you yourself have already tried or are taking semaglutide or Wegovy or Ozempic, please drop a comment below. Let us know what your experience has been. I'm sure it will be helpful to others reading the comments. Also, if you have stopped taking the medication or one of the medications because of the side effects, we're not able to tolerate it, please let us know. Again, thank you for listening, and share this video with someone who you think might benefit from it. Thank you. Bye.